We are recording.
Thank you so much. Welcome everyone. This is the Assembly's Health Policy Committee that I co-chair with Ms. LaFrance. We are scheduled from 10 a.m. to 11:30 today, and we'll go ahead and call roll, and then we'll do I'll just make note of who else is on with us, and then we'll jump into our agenda. Thanks.
Great. Ms. LaFrance?
Here.
Ms. Zolotel?
Here.
Ms. Allard?
Here.
Mr. Constant? Mr. Dunbar?
Here.
And Mr. Rivera?
Present.
Thank you.
Great, thank you, Ms. Leppy. We are also joined today by Incident Bob Dole. We have our Health Director Heather Harris, Municipal Manager Anna Thompson, Health Department Epidemiologist Janet Johnston, and Madam Mayor looks like she has joined us as well. So I just wanted to, and Mr. Weddleton. So I hope I caught everyone there. For some introductions, it's always hard sometimes for folks on the phone to know who's with us. So with that, I'm going to turn this over to Director Harris for a health department update. If you all recall from last month, it was a little bit more truncated. So we want to give Director Harris a chance to update us on what's been going on in the always busy health department. Please go ahead, Director Harris.
Thank you so much for the opportunity to share a little bit about what's happening here at the health department. A lot of the information I'll share today is associated with March activities and March numbers, given just the timing of some of these meetings and getting the reports from the team. But I'll start off talking a little bit about the administration division. So in administration, where the division is focused around human resource efforts, we've got 9 positions in recruitment. And we continue to have a lot of struggle filling our community health nursing supervisor positions, public health nursing, and our work service family aides. There's a lot of turnover in these positions just due to the non-competitive pay rates and higher demand on the positions themselves. And so we continue to just really work to try and increase those wages, and have had some success in the community health nursing supervisor positions recently, thanks to the administration and the assembly working through some of that. So really hoping that makes some impacts in the turnover rates in those positions. Administration's also division's been working on around fiscal items. We've got a big state grant, federal pass-through through the state for COVID-19 community funding in the amount of over $14 million. And we applied for that in February. We've been working on a memorandum of agreement and understanding, and recently got that completed. So really looking and having a lot of energy around getting those funds out into our community. There's a strong requirement for focus on health equity for those funds as well. So working with a lot of partners in the community and looking to get those monies out into the community as quickly as we can, so we can make some impacts around COVID testing and vaccine rates. We also continue to work, and the grants team is really helping to support a lot of funds moving through HUD. The CARES Act grants themselves in HUD will equal over $7 million once the last agreement is executed. So a real increase in there, and the team has been helping to get some of those funds out. Lastly, in the admin division, our emergency preparedness group continues to do great work around COVID response and working with the EOC, and also helping us here at the health department. This year we've had 3 floods, one that resulted in an evacuation of the building itself. And so our emergency preparedness team has helped to draft an after action report and improvement plan to really work on how we can improve our aging building. As we look at the Human Services Division, thinking about childcare licensing, a big thank you to the Assembly last night for passing a resolution in honor of childcare facilities. Just great work happening to keep people working and kids being provided great care in our community. And the childcare licensing program just continues to do great work, continuing to provide support and answer questions and make sure that the facilities are safe for kids and families in our community. We had 8 new applications for individuals interested in becoming a new licensed facility. So hoping to increase the opportunities in the area. They continued to assist call-in clients and walk-in clients and in emails at really high rates in providing support in our community. So big thank you to the childcare licensing group. They continue also obviously to help around COVID-19 efforts and mitigation and sharing a lot of really great information about eligibility. As we know, many in our community don't always know that they're eligible. So our childcare licensing team really being in great communication and relationship with providers has been helpful to get that information out as, the 16 and above became eligible. And now, just as of yesterday, 12 to 15-year-olds eligible as well. So great communicators there. As we look at our community safety and development program and group, they continue to work, as I shared a moment ago, around CARES Act projects, also around ESG and CV applications, and working with our housing and homelessness section to get that work moving forward, as well as moving our action plans, the 2020 action plan forward. That was submitted, the Assembly saw that and approved it on April 14th, and now it's being submitted to HUD and moving through that process. So looking forward to getting that money out into the community. All while also doing an interview for a new open CSD position due to a very long-term employee retiring. So looking to get additional capacity back into that program. As we look at housing and homelessness services, this group has been, as we know, it's a new group and just really developing and growing and providing great impact and investment into housing and homelessness work services in our community. They helped with the ESGCV funds and working with the CSD group, continue to research and help support and look at data elements and HMIS reporting. They continue to look at policies and procedures associated with the Anchorage Safety Patrol, recognizing that that RFP will be up soon, and so providing some great expertise in that area, as well as we saw the AZT RFP get released earlier this month and worked on some good neighbor guidelines in that area. So having the capacity in that group has just been a real benefit to the municipality and to our community. As we look at senior and emergency outreach, I just want to remind people that May is Older Americans Month, and we've got great work happening here at the ARDC. We continue to work with the senior centers, Anchorage and Chugach Eagle River Senior Centers, on reopen plans for April and looking at what that looks like to help support them to open safely. They also joined the Vaccine Hesitancy Advisory Board, being led by UAA and providing expertise and support in that area, and are getting funds out for assistive technology to get out to older Americans. Again, that was on the agenda last night too, and moving forward. Thanks for helping that move forward. Looking at Anchorage Safety Center and Patrol, there in the month of March, there were 396 unduplicated clients. That The increase in volumes are pretty seasonal and in line with previous years. So we're continuing to track that, and they're doing great work there. As I mentioned, there will be a new RFP open for that work coming up shortly, and the group was reviewing and recruiting new members for the review committee for that RFP. As we look at the public health division and think about environmental health services, I've shared with you guys quite a few times. They have been just heavily involved in helping to support businesses. Oh, is there a question? Or maybe just somebody was off mute.
Yes, please continue. Sorry about that.
No worries at all. I can empathize with getting mute is off at times. So environmental health, as I shared, really involved in efforts around COVID mitigation and safety protocols. They've also just been doing some really great work around the cottage food and seasonal and temporary permits, and really looking at how to streamline and support those efforts and sections within the community. And so excited to see those efforts moving forward. Also in environmental health, our educator is really focused on a few things that happen in May. One is in May is Bike Month, and Air Quality Awareness Week is in May as well. And so as we see today is Bike to School Day. We'll have Bike to Work Week or Bike to Work Day on Friday, May 21st. And so some great efforts in there of just getting people out and excited about biking. In the way of Air Quality Awareness Week, the spring brings sun and melting snow, but also brings dust. And so our team has been tracking that well and helping to provide support around kind of the dust season that we also find ourselves in. And May 25th is Heat Safety Awareness Day. As Alaskans, that maybe wasn't always our focus until, maybe the summer of 2018, 2019, where we recognized that Alaska can get quite hot. So just thinking about and preparing for the potential around that. As we look at WIC, WIC has been recognized at the health department this month as the employee team of the month, and really celebrating the great work that they're doing there. March was the 7th month of increased participation in the program, and excited to just see this team continue to provide increased support and services to some of our vulnerable residents in the municipality. As we think about SNAP Ed, our SNAP Ed program continues to do great work around helping and connecting with youth and persons experiencing homelessness and thinking about nutrition. The team has started to use a program called Around the Table, and it's a curriculum that really looks at principles around trauma-informed engagement and thinking about nourishment through hands-on cooking and facilitated conversations, and recognizing the impacts that food can have and associated with trauma, and really trying to work through those and provide a strength-based model and support around nutrition education. Our WIC breastfeeding peer counselors continue to have just a great outreach and reach on social media and some of their monthly live events. Their March event reached over 2,000 people, and they continue to have that really great engagement throughout their Facebook events. And as we look at policy systems and environmental projects around education, recognizing that we're coming into farmers market season, and SNAP and WIC benefits are eligible at participating markets. And so working with the community to let them know about that access to great healthy food at our local farmers markets. And then finally, around community health nursing, the team has provided 24 COVID vaccine clinics in March, had some focus around homebound clinics, also kind of pop-up clinics, looking at locations where we can really reach a larger group of people. I've had some great success with people in those pop-up clinics that didn't necessarily intend on getting vaccinated, weren't making it a priority necessarily to get scheduled, but we're happy to get vaccinated with the ease and access of it right there. And we continue to do clinics here at our facility as well. Again, lots of available appointments on anchoragecovidvaccine.com. And as we look at just boards and commission meetings and things coming up, today we'll have the Anchorage Women's Commission. On the 26th will be the Senior Citizens Advisory Committee. The 27th will be Animal Control Advisory Board. And on June 2nd will be Homeless Housing and Neighborhood Development Commission. So those are just some of the upcoming commission meetings on the agenda. And as far as an AHD update, we're also happy Dr. Johnston is on the line as well, and happy to provide a COVID update relatively quickly if that's of interest as well.
Thank you, Director Harris. I think for the COVID update, if it makes sense, we'll kick off the transition plan update with the COVID update, but go ahead and start with the folks in the queue here on your update. Is that okay with you?
Oh yeah, absolutely.
Okay, great. This is just a reminder to put yourself in the queue through the chat, or if you're on the phone, you can text me if you need to get in the queue. I need to note for the record, Mr. Constant arrived about 8 minutes ago, and Ms. Kennedy has been with us throughout the conversation. So my apologies for not noting those earlier. I put myself in the queue. 2 questions. What is the current status of the Alaska Treatment Center RFP? When does that close, I guess, is the question I have. And second, what is the status of rolling out the funding for child abuse, sexual assault, and domestic violence under the alcohol tax? And similarly, I presume it's the health department that will be rolling out the early childhood education piece of that as well. I'm just looking at timing, and we can do more substantive conversation later. Thank you.
Yes, absolutely. Great questions. So for the ACT RFP, that is scheduled to close tomorrow at this point. So tomorrow at 5 o'clock is the scheduled time for that to close. And then as far as the grants associated with domestic violence, sexual assault, ACEs, and early childhood ed, specifically not the early childhood ed, but the other group, we're currently working on an RFP and developing the plan now. We anticipate the RFP being available this early fall. Early childhood ed should be along the same timeline. How we get those funds out might look different than the domestic violence, sexual assaults, ACEs funding stream.
Okay, thank you very much for those updates. Ms. LaFrance.
Thank you, Madam Chair, and thank you, Ms. Harris, for the update. On the childcare licensing piece, and I know we all know how difficult it is to find quality childcare. I remember being really surprised 17 years ago when I was looking for childcare for my kids that you have to pay just to get on the wait list. And so I know that's been an issue for a while. I think I heard you say that there are 8 new providers, and I was curious if they are located all within the bowl. We know that Girdwood in particular has a shortage in, with the difficulty of their location as well. But I was also wondering if you could address the gap or speak to the demand. I'm wondering, what would it take to provide adequate childcare? And I know that's a complex question because there are also other options with pre-K and other facilities. So thanks.
Absolutely. So the 8 applications were not necessarily new facilities that came online yet. Those were 8 that were interested. And so the childcare licensing team does pretty extensive work to help support any new potential provider. We are always interested in increasing the providers in the municipality, recognizing that childcare has just been a real challenge, the accessibility of it for quite some time. And so I know that the team is active in trying to support and answer questions and be very accessible to anyone that shows interest in increasing facilities within the Anchorage area. I'm not positive right now where those 8 applications or interested sites were located, but happy to get, I think we're following up right now to see if we know that answer offhand within the team. And so happy to get that information back to you at another time, specifically thinking about Girdwood.
Thank you, Ms. Harris. That's great. I don't need an answer right now. Thank you, Madam Chair.
Thank you. Ms. Allard in the chat had a question if Dr. Chandler is on. Do you happen to know the answer to that, Director Harris? I do not see Dr. Chandler in our participant list.
He is not on the line at this point in time.
Okay, thank you.
If there's a specific question for him, though, I'm happy to see what his schedule looks like and if he is able to join us for any period of time.
Okay, great. Go ahead, Ms. Allard.
Thank you. I appreciate that. Yes, I would like to know his opinion on the mandates with masks and other issues. So if I would like to know if he could start attending these meetings so that we can ask him in the future, please.
I can definitely work with him on that for future meetings. Happy to do that.
Thank you, Director Harris. Thank you, Ms. Allard. So I think now any other AHD questions on the general update, and then we'll switch to Dr. Johnston on a COVID update. Okay, I'm not seeing any. It doesn't mean we cannot circle back. We will just move on. Dr. Johnston, you have the floor for a COVID update.
Thank you. So currently cases are trending down and have been for the past month. As of yesterday, there were 29,919 confirmed cases among Anchorage residents and 175 deaths. In terms of the 14-day average for new daily cases, we were at 10.3 per 100,000 yesterday, and based on preliminary numbers from this morning, I expect that to drop to below 9.5 per 100,000 residents today. So that is the lowest case rate we've seen since the surge in cases last July. But it's important to keep in mind that we really have 2 subpopulations at this point with very different risk factors. Stratifying on vaccination status, the 14-day average for unvaccinated residents is approximately 15 per 100,000 versus less than 2 per 100,000 for fully vaccinated residents. And I think as we go forward, it's going to be more and more important to keep in mind that we've got, these 2 subpopulations who really have different risk factors and therefore different behaviors that are needed. With the sustained decline in the number of new cases per day, we are seeing a decline in the number of new hospitalizations. However, we're not seeing much of a decline yet in the number of patients, hospital beds taken up by COVID patients per day. And we think that the reason for that, similar to what we're seeing nationally, is that we have more younger patients, or relatively younger. So we're seeing more patients who are in the 30 to 60 age range, and those patients are more likely to survive, but they require longer hospital stays in order to survive. On average, last week, the range of available ICU beds was 10 to 18, and we have currently 7 COVID patients in the ICU. As we've said before, the path out of the pandemic is through vaccinations. We're very excited that 12 to 15-year-olds can start getting vaccinated today. In terms of the number of residents who have had at least 1 dose of vaccine, we're just over 137,000 residents, counting vaccines that are given both through the state vaccine supply and through JBER. That represents approximately 60% of the Anchorage population. And then in terms of series complete, we're just over 120,000, and that puts us at 52.9% of the Anchorage population. So our hope is that with warmer weather and higher availability of vaccines, we'll continue to see cases drop and vaccine coverage increase. So that was a quick update, but I'm happy to take any questions.
Great. Thank you so much, Dr. Johnston. Ms. Allard, you're in the queue.
Thank you. I just received, and maybe others have, that notice that CDC said if you're fully vaccinated, I believe under certain circumstances, you don't have to wear a mask indoors anymore. So I think that's great. And I'm sure that will be addressed tomorrow. Thanks.
Great, thank you. Any other questions for Dr. Johnston before we turn to the COVID-19 transition plan? I do have one question. I'll putting myself in the queue. Has the dashboard on, and maybe this is for anyone in the administration, I don't know who's keeping the dashboards, but the dashboard on the municipal website showing the vaccination rate, does that currently take into account the newly eligible population of individuals 12 and over that we recently added? Thank you.
So we haven't added that. We're going to figure out over the next week or so how we want to display that. We plan to continue looking at the percentage in the 16 plus population so that people can see how we are increasing. And then we'll also add the 12 to 15. So we have to figure out the best way to display that at this point. But that does remind me, I should have mentioned that if you're tracking the percentages closely this week or the numbers, you may have seen a drop. There had been an issue with the state data that the numbers were slightly inflated due to some duplicates that needed to be pulled out of their numbers. They fixed that on Monday night, and so there was a little bit of a discontinuation in the numbers during the week, but the numbers that I just reported now are the accurate numbers with those duplicates taken out.
Great, thank you. And I do have one additional question before we turn. As was mentioned last night, we're starting to see the school district leave it somewhat up to the buildings to decide whether or not children can unmask during recess or outdoor time. Are you still coordinating closely with the school district about their policies and the decisions they're making around masking and COVID protocols? I just hadn't heard an update on that coordination in a while.
We're continuing to collaborate and connect with the school district, but ultimately those are decisions within the district. And so we have a good relationship and connect and partner and discuss things regularly, but aren't necessarily involved in the ultimate decision process.
Okay, thank you, Director Harris. Okay, thank you, Dr. Johnston and Director Harris for those updates. Very much appreciated. So next we're going to turn this over to EOC Incident Commander Bob Dole to kick us off on the COVID-19 transition update. Mr. Dole, the floor is yours.
Good morning, Incident Commander Bob Dole, and I will be covering 3 areas as part of the update. First, the overall transition progress. Second, mass care transition progress. And third, what I call following the money. First, transition progress. We are proceeding with the transition plan as we previously presented to this group and are on track to effect the changes next week of standing down the incident management team, including the incident commander at the Emergency Operations Center as a command and control entity over all municipal efforts. In lieu of that, there will be a coordinated effort between 3 key shareholders: the Anchorage Health Department, the Development Services Department, and the Office of Emergency Management. These 3 working together will continue to coordinate between them to continue to operations responding to the COVID disaster. In terms of quick review functionally of what that looks like, vaccines and testing will be, those functions will in whole go over to the Anchorage Health Department. They are augmenting their public information officer team with a COVID-specific public information officer staff, and also standing up a emerging infectious diseases branch to do the vaccines and testing that are currently being done in the Emergency Operations Center. The mass care function will temporarily be housed over at Development Services Department. In doing so, we're retaining over 40 years of direct provider experience on staff that they have in dealing with and running PEH shelters, doing case management, and working with PEH provider systems. Physically, they're over here. They moved over on Monday. They were here for our first bear sighting of the season at the Permit Center. As we're going forward, we are demobilizing the Fairview Rec Center as a congregate shelter on Friday, and we had a contract with Covenant House of Alaska for doing about 20 young adults in a congregate setting in their gym. We're standing that contract down next week. We believe that with reduced demands elsewhere in the shelter system, this will not create any new requirements for number of rooms or requirements on the Sully. Previously, we talked about the mass care transition report. The actual written report we're now projecting out on the 18th. Just with the complex number of data streams that have gone into that and different experiences of different providers, we could have given it to you badly now, or we'd like to do something that's useful and not done badly and present that to you. And we need a little more time to distill the different pieces of that going forward. And then yesterday we had there was discussion at the Assembly about why we were seeking to project out additional contracts through September. We're at a point where we're experiencing hotel hesitancy for the non-congregate shelter contracts going forward, and many weren't interested in a 2-month gig, and we have determined we cannot get out of our current footprint fast enough. We are continuing in the contract negotiations for intensive housing case management contracts are continuing if funding is available for that. And also we're working with the HLC and other PEH partners to make sure we coordinate our efforts to provide a pathway out of the mass care transition. Also, as part of the transition, we'll continue the weekly mass care transition meetings with our external partners. Looking at the EOC Light will continue to exist in the Office of Emergency Management. It will not have a command and control function, but rather a support function. Those functions for the disaster will include finance, the ones who develop projections and keep the money on track for cost recovery, logistics, to affect what needs to be done, public information, and liaison. Some additional specifics on the mass care transition. I think you will see as we're going forward, there will be an increased emphasis on outflow. And we need to recognize that the loss of provider capacity due to increased separation requirements, at the same time the number of PEH clients substantially increased, means the old business model, we can't get back there. We're going to have to find different ways forward in terms of addressing the requirements. We believe the way forward is focusing on transition rather than shelters becoming a longer stays at those while solutions are found. We need to accelerate the time to find long-term solutions. Last, looking to the money. At this point, there is not a declared end to the federal disaster and available of FEMA public assistance reimbursement for emergency response measures. Those emergency response measures include mass shelter, vaccines, and testing. Up until September 30th, the federal government has waived any state share, meaning the federal government will pay 100% of those costs. The state, in its grant agreement with the federal government, has committed to, beyond that point, it will pay for the local match, the 25%. What they signed basically a grant agreement with the federal government committing to that portion. Our commitment, I believe, of all the departments, though, is to be frugal and focus on drawing down and not dragging it out as we go forward. So, and just a quick note, when we talk about what is reimbursable, only what is directly related to COVID response activities, particularly for staff functions, this is a gotcha, is reimbursable. So we have to demonstrate if we retain staff that what they're doing is attributable to the COVID response. Otherwise, it is not a FEMA reimbursable item. You see that structurally with how the three departments have delineated separate staff positions that focus on COVID, and our commitment as the three departments get together has to be to make sure we have no mission creep into those areas just to protect this plan going forward. This completes my summary, and I'm Director Harris is here for any AHD specific questions on how they're going forward with vaccine and testing roles, and I'm available for anything else for your questions.
Great. Thank you, Mr. Dole. I put myself in the queue. I'll kick off some questions. We want to really encourage members to ask questions as we get the opportunity to get these updates on the COVID transition. I actually have 4 questions, so I'll ask a couple and then I'll jump back in line. On staffing reassignments that are currently in place, could we get maybe a chart kind of where those COVID response areas are within the departments? And then how long is it anticipated that those COVID response staffing areas will exist, or do we not quite know yet?
Chair, to respond to your questions, the staffing reassignments are primarily contractor employees at this point, probably 95%. I think there's just a handful of actual Muni employees who are reassigned. One thing we know about COVID is we don't know about COVID to project out how long those are. If I had to look at my crystal ball, I would project out that we won't see an end to the federal declaration, after which we'd have 6 more months to be able to use FEMA funding for doing roles. I don't believe we'll see that before September 30th, meaning it'll be 6 months after that we'll have eligibility for federal funding. But it really depends on how the virus behaves and how the response progresses. Frankly, we're seeing movement out of the shelters now as folks are finding their own solutions, which is awesome. And it would be very speculative for me to say how fast we can get out. I want to get out as fast as possible, though.
Thank you. I appreciate that. And then a follow-up of a question I actually had last night, which is around PPE. Do we have a sense of the current needs by the municipality, and then how much community need is being run through the Emergency Operations Center right now?
Through the chair, to answer your second question first on PPE, right now the municipality is providing no PPE to the community. The regular commercial supply chains are available to accommodate that, and they're doing so. We stood down the PPE distribution center a couple months ago at the Spinard Rec Center, and entities are taking care of their own needs without incident. The supply chain has restored itself. The Anchorage does have ongoing PPE consumption of its regular employee population, just as what's necessary for direct encounters, be it mask or gloves or whatever. Obviously, we all think of our first responders having to garb up in settings, but even the rest of our workforce for certain settings are consuming well above previous baselines. We will get a number to you. That's part of a separate project we have underway this afternoon.
Great, thank you. Next in the queue is Ms. LaFrance.
Thank you, Madam Chair, and thank you, Mr. Dole, for this update. Appreciate the information. I was actually going back over last month's presentation with the numbers and the facilities that you had provided, and noting that with more resources for case management available, hopefully that will get us closer to implementing the transition plan. And it's good to hear that some folks are self-resolving. I'm concerned about the 4.5 months to work out the transition, especially since the end of September is when the weather starts getting colder. And in terms of resources from your view, what do you think at this point we need to prepare for to ensure that we don't end up in a situation where the municipality is going to need to, get more hotel space and rely on more emergency short-term measures, which are much more costly and don't address the root cause? And I know we've relied on nonprofits to do the heavy lifting when it comes to homelessness and sheltering. So just from your perspective, what do you see the potential, risk, to the municipality or the cost in terms of this transition, or any other resources that we may not be queuing up that we need to? Thanks.
Co-Chair LaFrance, to answer your questions, I think in looking at the resources available, what is vital is that we focus not on how to increase shelter capacity, but rather how to reduce shelter demand. To do that, we need to focus on where we can leverage and get in place, either short-term, maybe through ARPA funds, and longer-term with other fundings, federal and local resources out there, as well as private provider ones. Effective housing case management so that the shelters become a transition point. And I think that's what's key. We need to kind of reset the model going forward with a comprehensive operationalized HMIS system, focus on coordinated entry and resourcing that. And then in conjunction with that, we need to recognize substance use disorders as a significant barrier out there and identify what the best resource is to address that need. It is an ongoing challenge. I think it isn't the only challenge, but for one group in particular, for the group that is struggling with this area, it is a substantial barrier to long-term housing. But overall, I think the focus has to be more on to get throughput rather than anything else. We have, based on prior discussions, we have an intensive housing case management contract RFP that closed. We have a contractor we're working with to flesh out the details of that, but I believe that is a major piece, but we also have to address the other means to increase throughput rather than facilities becoming a parking place or for extended stays at them, which doesn't benefit the client or the community, and all in long-term cost more.
Thank you, Mr. Dole. And if I just may follow up briefly, Madam Chair. So do you believe then, Mr. Dole, that with the transition plan, we're on track then to be where we need to be by the end of September?
Yes.
Great, thank you.
Thank you, Ms. LaFrance. Mr. Constant, please.
Thank you, Bob. My question only rose when you suggested that people are getting out of the shelter and finding their own solutions. And I'm afraid that part of that is a euphemism in the fact that I have sectors in my neighborhood that are having daily increases in tents in more than one or two. Like all of a sudden people are just showing up in tents. And I'm afraid that a good measure of the number of people who are finding their own solutions are finding their own solutions on the streets of our neighborhoods. Do you have a sense of how they're breaking out, where they're going, what's happening?
Through the chair, Assemblymember Constant, not completely. We recognize that we have some that have reverted to unsheltered with the warm weather coming in. Frankly, though, we're also finding several, and this is where a more effective HMIS system will really benefit us, who have found jobs, they found employment, they've qualified for housing and are moving out into that setting. I think of 6 of the recent folks that left the non-congregate shelter system. They moved into apartments with jobs and long-term solutions. We recognize there's an issue there with unsheltered, and frankly, that's also why we have to retain capacity to abate those situations, but as necessary. But there is also, with the economic uptick and opening up, there are many who are also finding options there and is facilitating those options. That's key. I'm working with a nonprofit group to create move-in kits to overcome some of the initial challenges if somebody is unprepared to move because they don't have a bed or a frying pan or a plate or whatever. So I'd say it's a mix at this point, and I don't have good data for you, Assemblymember Constant. Sorry.
Well, it might be good then for us to come up with a method to track, but I understand that's pretty challenging. So clearly there is an increase in population on the old Alaska Native Hospital site, and I know it's set for abatement soon, but thank you.
And Assemblymember Constant, I believe a more effective deployment of HMIS in our in the mass care system will facilitate that. That's why one of the folks that I have on staff is a HMIS expert. So.
Thank you, Mr. Constant. I put myself back in the queue, and again, encourage members to jump in here with questions. To what extent do we know what the census will be from our nonprofit and established shelter providers moving, through the summer into the fall, or has that not yet been identified? I think that's an important data point for us to know as we continue to make plans. And then I know we're concentrating on congregate shelter and trying to bring the Sullivan back to its original purpose, but what efforts or support are needed to also look at the non-congregate shelter numbers and try to bring those numbers down as well? Is that simply support for housing programs, which I think we saw in the proposed ARPA funding, quite a few housing programs, or is there something else that would be helpful in supporting those efforts?
Chair Zalatel, to answer your your two questions. First, we don't have a good feel yet for what the non-MOA shelters are projecting for their census numbers this summer. We look daily and follow their numbers on our dashboard. I think we are seeing some openings in them as we are in ours, but I don't believe there is a good forecast out there at this point. If we looked across the entire set of enterprises, what would look like. Overwhelmingly, the solution to non-congregate shelter is the same as congregate, and that is focusing on throughput. New York City has discovered this much more extensively than we have. Non-congregates tends to be stickier to get people to move on, but ultimately it requires lining them up with a long-term solution and finding ways to facilitate their getting into that. The same ARPA solutions we have for proffered for the mass one in terms of housing intensive case management coupled with rental guarantees also facilitate working to get folks out of the non-congregate system as well. We recognize we have to solve that piece, that we can't declare victory after we've only dealt with the Sully. We have another 250 rooms or so also that need to be part of the mix. We believe going forward, our proposal, as well as other ones out there, private sector and HLC efforts, will step up to address those needs.
Okay, thank you. And then do you happen to know, or could you speak at all to the accuracy of the data dashboard on the municipal website? I'm not certain if there's still a coordination point for that dashboard in terms of shelter capacity. And the reason I ask is, as we see camp abatement begin, shelter capacity will always be at issue.
Through the chair, to my knowledge, we have addressed the accuracy issues of capacity and who are in those. There's one area that's slightly confusing with Covenant House Alaska, because they have a total capacity of 40 in non-congregate and 20 in congregate. Right now, we have contracted for that 20 congregate setting for young adults. And as we back out of that one will be accurate. But to our knowledge, we meet every Thursday at 1 to discuss data. We don't have any accuracy issues with it. Occasionally, we'll have a non-reporter for a day or two, but overall, there's a high degree of accuracy in these numbers.
Great. Thank you, Mr. Dole. I have one more question. I don't see anyone else in the queue, and this one might be for the health department. Could we talk a little bit about testing and how we see testing for COVID rolling out over the next several months? Has there been any indication by the CDC or others about the level of access to testing that will be required, or does it calibrate at all with vaccination rates? So I just like if there's any updates in terms of how we can look at testing as we kind of work through this transition phase, and what level of testing we may be wanting to keep for a period of time. I'd really like to learn more. Thank you.
Absolutely. Thank you, Member Zalatel. We're always evaluating the capacity and uptake of testing at each of the facilities, and analyzing that and making sure that we're using resources appropriately there. I think Mr. Dole can probably speak to that historically anyways. As far as moving into the future, we are seeing CDC guidance shift around fully vaccinated individuals. Recently, we saw those that are fully vaccinated don't necessarily need to do regular screening types of testing, only when there's symptoms specifically. So we're seeing a shift, and as we increase vaccination rates, get up to our goal of 70%, that is going to impact the number of people needing to get tested and what that might look like. And so we are looking at adjusting our testing strategies and testing resources around the municipality accordingly. We do continue to see the need for testing for those that are not vaccinated. So wanting to make sure that resources remain available for those that are not vaccinated. And specifically, as we think about that, for those that aren't eligible for vaccination as well. And so testing is likely to continue to be a part of our life for a period of time. But just like everything in COVID, it's ever changing. And so we will change with the guidance and make sure to be using resources appropriately and accordingly. But happy to keep you involved as that guidance and as we make some shifts through the summer and determine things through the fall.
Great, thank you. Yes, that would be really helpful context as we get our weekly reports currently, and hopefully we can figure out a way to continue to get updates, as we do transition. Because as I was doing the math last night, and I just want to point this out, I think as we were talking about the ongoing need for testing and the testing capacity, it was about $161 a test. So that seemed reasonable to me, but I think is that number, or is the cost per test, or is it based on the number of tests we do?
Through the chair, for the contract we have now, it is the cost per test is the negotiated contract with Visit.
Okay, great. Thank you. That's helpful context. Are there any other questions about the COVID-19 transition plan update? We will have the opportunity to revisit this again in early June, which is not as far away as is typical between these meetings. But I know that we do discuss the COVID-19 transition at nearly every assembly meeting. So I want to make sure we give the space and opportunity for questions or questions to be raised if more information also needs to be gathered. Okay, I'm not seeing any. We'll go ahead and move on. If any questions come to anyone, please be sure to pop yourself in the queue. So next on our agenda is committee legislative and budget priorities. Ms. LaFrance, did you have anything you would like to share in either of these areas?
I don't right now, Madam Chair. Thank you for checking.
Great, thank you. And then I think what we'll do for budget items for 2021 is we'll just use that as an opportunity as we move through and the alcohol tax items start to work through for the RFPs, sorry, to get updates on where those processes are. I think that's an important thing since this is the first time we've done these particular appropriations or RFPs through the alcohol tax, that we're just keeping track of those. Okay, then I think unless anyone else has anything for committee legislative and budget priorities, I will say we've talked about HMIS a little bit today as part of the COVID-19 transition plan update, and we will actually be taking that up at the Committee on Housing and Homelessness on the 19th. So if you are wanting more information about that, if you like to talk about data as much as I do in that area, we'll be having that conversation next week. Okay, well at that, let's move to audience participation.
Hello?
Yes, I believe that's Mr. Haberman. You may proceed when you are ready.
Okay, I got my timer. My name is Eugene Carl Haberman, 43-year Alaska resident, approximately 20 of those years, Anchorage resident, currently a Valley resident. A couple of points. Number one, as you know, I listen to your meetings, and as a member of the public, and in this case of this meeting, the only way we could listen as a members of the public was audio and no Zoom, no connection to be able to visually see the meeting. And also any of the documents on the website, there was nothing there except for the agenda, okay? But we were lost as a member of the public to the details of the presentations. And that is a problem. And particularly when we're in COVID time, we should have more of a conversation with people, and the public should have more access to what is being said in the materials and so forth. But I'll go into the item that was the last item that was laid on the table and approved by the Assembly last night toward the very end of the meeting. The document that was laid on, and with the intention that's by the chair that you would have a town hall meeting on Monday.
Oh, Mr. Haberman, it looks like we lost you. Are you still there? Okay, I think we may have lost Mr. Haberman. If he comes back, we will give him an opportunity to finish his thoughts. Is there anyone else who'd like to participate? And I just want to verify you all can hear me. It's not a glitch on my end.
Yes.
Okay, thank you. Don't always know. Okay. We will go ahead and see if there are any committee comments, if there's no other audience participation, and then I'll see if I can circle back to Mr. Haberman. Is there any? Yes, Mr. Weddleton, please.
Oh, thanks. I just want to real quick. I know Eugene's offline, but he was asking about or saying that he couldn't see any of the documents, but I'm not aware that there were any documents beyond the agenda. Is that correct?
That is correct. Yes.
So he got to see everything. Thanks.
Yes. Hi, Mr. Haberman. I will give you an opportunity to complete your comments. We just as you were coming back online, Mr. Weddleton pointed out, and we confirmed there were no documents for this meeting today. There were no visual presentations beyond the agenda. Please continue, though.
Okay, and thank you. Fortunately, I kept my password number to come in and so I could quickly call back. Thank you. What I'm going to basically say is in reference to the item that was laid on the table toward the end of the evening, the chair, Rivera, respectfully made a note that there would be a town hall meeting that had not been scheduled in, so it wasn't showing up. The clerk did not know about it when I was while that was being announced and so forth, and it was for Monday. And then they're going to do a separate meeting Tuesday for a public hearing on that item. The reference is dealing with $51 million. This is getting to be very fast tracked, but most critical is this, and I'll leave you with this thought. The two most important decisions you have to deal with decisions is the certification of election and approval of the budget. What's happening, and you're scheduling that a meeting for a Monday, and that's not a public hearing, but at the same time as there will be a session of the canvass meeting Monday night, and earlier from like 4 to 5 there will be a work session with the Election Commission, and it's critical that you do not have conflicts between the review of those ballots with the public's attending. We're talking about two critical areas where the public can be engaged, whether they're observers or not. And you tend to leave that, allow that period of time where there's nothing in conflict. So you don't schedule something, but you're doing this with this other item. And I'm not saying that it's not important, but Tuesday night, you're going to be having a separate meeting dealing with the recount and certification of that, and talking about school board seats, 2 of them, that recount. And the end result is you're creating a situation for the public to be able to attend that meeting on Monday night, which is going from 4 to 5, and then there's going to be a separate meeting, I believe, from like an hour going into, and you can see it's posted on the website way in advance by the clerk. So I urge you not to have anything happening that Monday night that you're doing to create that conflict, because you need to show that you're really making some degree of effort for the public to be able to be there. And people are concerned of how you're doing funding of COVID. And this is how you're doing this thing laid on the table Friday, last night, and then putting out the meetings for Monday and Tuesday. This is not going to be good at all. Thank you. That was my comments. Okay.
Thank you. Do we have any other audience participation tonight or today? Sorry, it is still daytime. It is still before noon. Anyone else? All right. Any last committee comments? All right. Well, I appreciate everyone's joining us today, and we have been continuing to schedule these for additional time. I suspect we'll do that one more time for next month so that we do leave plenty of opportunity for there to be conversation and discussion around the COVID-19 transition, so it's not a rushed conversation. So with that, we will be adjourned, and thank you all so much.